They know where the virus is, they don't know where the people are. 26,000 possible contacts, and 88% of exposed people can't be found. Africa's top health official has a warning: the outbreak hasn't even peaked yet. If this isn't stopped soon, it will be worse than West Africa, worse than anything the continent has seen. So, who exactly is carrying Ebola tonight? Health officials are warning that the current Ebola outbreak in the Democratic Republic of Congo could become the deadliest outbreak the world has ever seen. The alarm was raised by the head of Africa's Centers for Disease Control and Prevention, who says the situation is becoming increasingly difficult to contain as thousands of potentially exposed individuals remain unaccounted for. Speaking during a virtual meeting of African leaders and international donors in Burundi, Africa's CDC Director-General Jean Kaseya warned that unless the outbreak is brought under control quickly, it could surpass previous Ebola crises that devastated parts of Africa.
If we don't stop this outbreak very soon, it will be even worse than what we had in West Africa and the eastern part of the Earth. Overall, with the expectation to have 33,000, we are just following 12% of our people.
Jean Kaseya compared the current situation to the 2014 to 2016 Ebola outbreak in West Africa, which affected Guinea, Liberia, and Sierra Leone, and claimed more than 11,000 lives. He also referenced the major outbreak that struck eastern Congo in 2018. According to the latest government figures, the number of confirmed Ebola cases in the Democratic Republic of Congo has now risen to 837, including 197 deaths. But officials fear the real scale of the outbreak could be far greater. A major concern is the growing failure of contact tracing efforts, which are considered one of the most important tools for stopping the spread of Ebola. Kaseya told Al Jazeera that tens of thousands of people who may have been exposed to the virus have not yet been located. According to him, more than 26,000 potential contacts remain untraced. Health authorities do not know where these individuals are, whether they are infected, or whether they may already be spreading the virus to others. The warning comes as aid organizations report that the outbreak has not yet reached its peak. Bruno Michon, operations manager for the International Federation of Red Cross and Red Crescent Societies, said there are concerns that the epidemic could continue for as long as a year before it is finally brought under control. Officials say that more than a month after the outbreak was officially declared, the full extent of the crisis is still not known. One of the biggest challenges remains traditional burial practices. The bodies of Ebola victims remain highly infectious after death, and health experts warn that unsafe burials continue to be a major driver of transmission. Family members handling bodies without proper protective equipment can unknowingly spread the virus to others, allowing outbreaks to grow rapidly. As the number of cases continues to rise and thousands of potential contacts remain missing, health authorities are racing against time to prevent a larger catastrophe. The virus is moving again. New health zones report infections almost daily, and a crowded displacement camp records Ebola deaths. Health officials warn the outbreak may be entering a far more dangerous phase. Health authorities in the Democratic Republic of Congo are raising alarm as Ebola spreads into new communities across the country's northeast, including densely populated displacement camps where aid agencies fear the virus could spread rapidly. The outbreak, caused by the rare Bundibugyo strain of Ebola, was declared on May 15th and has already infected hundreds of people across Ituri, North Kivu, and South Kivu provinces. According to the World Health Organization, there have been 676 confirmed cases and 136 deaths, with another 119 suspected infections under investigation. WHO Epidemiology Chief Olivier Lepaulin said new health zones are reporting cases on a near-daily basis.
That reflects really the scale of this outbreak, a scale that is much bigger than what is being detected, and the high mobility of the population. There are still many blind spots in some areas that are high risk. The full scale of the outbreak is not yet clear and will get more clarity as surveillance improves.
Health officials say the virus is no longer spreading only through travelers arriving from known hotspots. Instead, local community transmission is now being detected in newly affected areas, raising concerns that surveillance efforts are struggling to keep pace with the outbreak. The warning comes as the United Nations Refugee Agency confirmed the first Ebola-related deaths inside the crowded Kapanga displacement camp in Ituri province. Aid workers say conditions inside camps could accelerate transmission, with hundreds of people sometimes sharing a single sanitation facility. The outbreak presents a unique challenge because no approved vaccine or treatment currently exists for the Bundibugyo strain. The WHO says isolation facilities remain well below anticipated requirements and that contact tracing, while improving, is still insufficient to bring the outbreak under control. Decades of conflict in eastern Congo have left many communities isolated and vulnerable, with armed groups operating across mineral-rich regions where government control remains limited. Neighbouring Uganda has reported 19 Ebola cases and 2 deaths linked to the outbreak, though African health authorities say the situation there remains under control. With blind spots still widespread, isolation capacity critically low, and a displaced population highly mobile, health officials say the outbreak has yet to reach its peak. The World Health Organization has declared the Ebola outbreak in the Democratic Republic of Congo a global public health emergency after suspected infections surged past 300 cases and deaths climbed towards 90 across eastern Ituri province and neighbouring Uganda. This is not the more familiar Zaire strain that drove previous Ebola epidemics. Health officials confirmed the outbreak involves the Bundibugyo virus, a rarer and less understood variant for which there are currently no approved vaccines or targeted treatments. The WHO now warns that the true scale of infections may be significantly higher than reported due to limited testing capacity and ongoing insecurity across the region.
After having consulted the DRC and Uganda, where the Ebola disease caused by Bundibugyo virus is known to be currently occurring, I determined that the epidemic constitutes a public health emergency of international concern, as defined in the provisions of IHR.
Uganda has already confirmed imported cases tied to the Congolese outbreak, including one patient who died in Kampala after traveling from eastern Congo. Another confirmed case has reportedly emerged in Goma, a strategic city now partially controlled by M23 rebels. Health officials say fatality rates for the Bundibugyo strain can reach 50%. The crisis is unfolding inside one of Africa's most volatile conflict zones. Armed groups linked to the Islamic State continue operating across Ituri province, complicating contact tracing and forcing medical teams to work under military protection.
The Bundibugyo strain has no vaccine, no specific treatment. This strain has a very high lethality rate, which can reach 50%.
The WHO says border closures are not recommended, warning they could drive unmonitored crossings and worsen regional spread. Instead, neighbouring countries have been urged to activate emergency response centres, intensify screening, and isolate suspected cases immediately.
Significant uncertainties remain regarding the true number of infected persons and the geographic spread of the outbreak.
This is now Congo's 17th Ebola outbreak since the virus was first identified there in 1976. But unlike previous emergencies, this one is spreading through mining corridors, conflict zones, and urban centres simultaneously. Central Africa is once again confronting one of the deadliest viruses on Earth without a proven vaccine to stop it.